Welcome to the Healthiest Tech Talks, where we're talking about some of the biggest challenges facing healthcare organizations today and how technology can transform the way we work so that patients receive better care. I'm your host, Natalie Tollefson, Senior Director of Customer Success at Optimum Healthcare IT. Let's dive in. All right. Well, thank you, Scott, and welcome everyone to our 5th episode of Healthy as Tech. Today, I am joined by two of my favorite people, Shelby Johns and Louie Gomez from our very own Optimum team. Shelby is our resident expert on all things clinical engineering and biomed. Shelby is a business process consultant here at Optimum, focused on clinical device management. She has a master's in clinical engineering and has worked as a clinical engineer in both adult and pediatric hospitals. And she has 5 years of experience in the ServiceNow and CMMS space. So I'm so excited to have Shelby here. And then Louie started his healthcare journey in the emergency department as a technician. And after about 4 years, moved to working with Epic. So Louie's been working with Epic, certified on multiple modules, ASAP, Optime, ClinDoc, and Orders. And he's been working on ServiceNow platform for over 8 years, all in healthcare. And he is our chief architect here at Optimum. So Louie and Shelby, welcome. Can you guys share a fun fact about yourselves?
Yeah, good to be here. I love to play pool billiards. I play probably about once a week, maybe a little bit of a shark at it, not to toot my own horn.
You come across so unassuming. So I love that secret
Uh,
power that you have. Awesome.
Thank you.
What about you, Louie?
Yeah, speaking of sharks, I actually love to go scuba diving and I love to go follow the shark migrations, and we try to see as many sharks as we can while underwater.
Very
That's
cool,
amazing. Weren't
actually.
you just in
Also toot
Costa
your own
Rica?
horn.
I was in Costa Rica. We ran into a couple of white tip sharks while we were there.
Oh my gosh. So we have two sharks on the webinar today. So awesome. Well, thank you guys so much for being here. I'm excited to jump in because I think a lot of our listeners are, really interested in this topic. I know, all of us get a lot of feedback and have conversations about what ServiceNow is doing with clinical device management. And so I'm really excited to talk about this today. And we're just going to unpack, some of the biggest challenges that we hear from our customers and from hospitals and health systems about the work order process, about tracking inventory, about user experience, and, just how to make this process better and how to modernize, right? And so Louie and Shelby, you guys, live and breathe this. And I'd love it if you could, for our audience, paint a picture of, what is it like day to day? What are the challenges that clinicians and technicians are facing?
Yeah, so starting with the clinician side, oftentimes the clinicians aren't sure where exactly where to go to submit some of these work orders. It's very fragmented. There's multiple systems. Every hospital has that infamous closet where all of the devices just kind of get shoved into because the clinicians just aren't sure, how do we get these fixed? We need to get them out of the way. And so they just end up being moved out of the way. So that's one of the real issues that the clinicians have is, where do I go to submit some of these issues? And then from a technician standpoint, it's there's so many different systems that I need to document, and they leverage either their current CMMS product, or they're relying on Outlook and email, Teams, OneNote to store all of their documentation. Because this documentation lives in multiple places, it's really impossible to do any sort of reporting. And reporting is really critical when it comes to clinical engineering, because of our compliance requirements. We need to be able to document and have all of our documentation in one place. So when an auditor comes into your hospital, it's very easy and seamless to run these reports and then generate for the auditors. And having these fragmented systems really creates, a couple of different problems for the hospital. One of the problems is just a financial impact. So there's loss or significant financial losses over a period of time. Either the hospitals are purchasing too much equipment because the equipment just isn't getting fixed correctly, or it's getting shoved in, that infamous closet, or it's just not getting used or leveraged as it should. So we're not getting the full value of some of these clinical devices if they're not being able to be maintained correctly. And it also compromises the patient safety as well. If the technicians can't find these devices to perform the maintenance correctly, or it's too cumbersome, it has a big impact on the on patient safety as well.
Yikes. Yeah, I mean, this is just like another example of, it may be seen as a field service system or a process or an IT process, but it has the ability to affect the bottom line. It has the ability to affect patient care. So that's a little bit scary. I mean, Shelby, you've lived and breathed in this world for a long time. What's your take on it?
Yeah, I think everyone's busy. You go into a hospital and everyone's running around trying to get as much done in their shift and taking care of their patients. And techs are trying to complete PMs on top of completing repairs and going and getting equipment off the floors and repairing them as needed. So, how do we bring their job with them? How do we bring the CMMS with them? Is
Hmm.
what we're looking at solving.
Yeah, and that's a great transition point because I'm excited to jump in. We like to bring, not just talk about the issues, but we like to show our audience the solutions. So we are going to be digging into three major challenges that health systems face today as it relates to CMMS and clinical device management. But we're also going to be showing you ServiceNow's latest and greatest mobile app for clinical device management and some of the fun tweaks that Optimum's been able to make to it to make it even more powerful for our healthcare customers. So with that said, Shelby, can you help tee us up to the first major challenge that we're going to talk about today?
Yeah, so the first big challenge we're seeing is that submitting medical device issues, the clinicians getting those issues to the biomed or clinical engineering techs so that they can go repair equipment. A lot of hospitals either have separate portals for submitting issues between, IT facilities, biomed, and maybe they are all in one, but at the end of the day, the clinicians still have to go sit down at a computer, log into the system, and submit that issue. So how do we put that report medical device issue reporting in their fingertips is where we need to be looking because they're going to have a phone on them no matter what. And so if we're getting them to submit issues, there's less devices that are ending up in a corner or sitting around with an issue, a lot of times an issue sticker on it saying broken, and a biomed tech has to go find it on the floor. How do we get them that issue quicker and so that that turnaround on that medical device is quicker and it can be put back into use? And also we have need to have better data with how many repairs are happening for leadership to be able to see that. So this raises a question of like how can we provide more modes of submitting an issue for clinicians?
And it's interesting because we're all so accustomed to doing everything on our phones. I mean, it's so easy to order something from Amazon or to look up information. And yet, within the hospital walls, we still find that there are some processes that, don't have good solutions for that until now, at least. Right. So,
Exactly.
Louie, you're our ServiceNow pro. Can you show us what it looks like for a clinician to be able to submit and manage those work orders on a mobile app?
Yeah, absolutely. So, first thing with these mobile devices, a lot of your clinicians may already be carrying these mobile devices to document within their electronic medical record system. This is really just going to be an additional app and expansion of the devices that they're already carrying. And the functionality that we can build into these mobile apps is a lot of different features and connectivity. Today, we're going to be talking specifically around clinical engineering, how to submit these work orders, but we can leverage some of the features of the phone, such as the camera, to take pictures of a barcode or your asset tag or serial number that you have located on your devices. The clinicians can open their mobile device, click, I need to create a work order. It immediately opens up the camera so they can scan a barcode. They can scan both linear barcodes and 2D barcodes. They scan the barcode, and this is a one step feature where they scan and then hit submit. Just from that action there, it'll create a work order. It knows which technician is going to service that location, and we know the location of the asset because it's already stored within our enterprise asset management database. So it's a very quick one step. Clinicians can pull this out, take a picture of that barcode, hit submit, and they're done within a couple of seconds. And it's already been dispatched to a technician to that location. The next step is a two-step process. So it's very similar. The technicians can, or the clinicians still pull out their phone. They can still scan that barcode. But in this one, we can add an additional description. So I can document that the device does not power on, hit submit. The same thing happens in the background, but now the technician has a little bit more information before they arrive on site. And this last demo that I want to show specifically for the clinicians is going to be your more traditional intake form. This is really the form that we're trying to get away from because it's very cumbersome. It takes a little bit more time. The clinicians need to look for a specific asset. They have to document their location, document exactly what's going on with the device before they hit submit. And it just takes a lot of time. Yes, the clinicians can access it through their mobile device, but it's the extra clicks is what makes it a little bit cumbersome. So we're really focused on building that foundation for our clinical engineers to have all the information preset within their asset management database. So the clinicians don't have to go through a multi-step type form to document any of the intake. I know we're
Yeah,
talking a lot about, oh, go ahead, Shelby.
I think you made a really great point here with showing the three different ways that you could, different how much data you can ask for. And I think it's really important to emphasize that the organization can decide how much they want to ask from their clinicians when submitting an issue, what fields they want to be required, what they don't, what they want the clinicians to see from, location, asset information, submitting a photo, that kind of stuff.
Right, right. I know we're talking a lot about mobile here, but we really want to meet the clinicians where they're at on a day-to-day. Mobile
Mm.
is going to be one of those components within your electronic medical record system, such as an EMR help would be a secondary, where the clinicians don't necessarily have to go hunt and find for a different website or a different resource or a different phone number to call. They can do it exactly where they're at on their day-to-day basis.
So, Louie, you're saying that if a clinician is, in the middle of documenting within their EMR and they have an issue with the clinical device, they can submit an issue directly from the EMR as well.
Absolutely, absolutely. And some of these computer on wheels that the clinicians are using also have a barcode scanner as well. Clinicians oftentimes use these barcode scanners for their medication administration. So we can still leverage that barcode type feature even on the desktop type app where they're running their electronic medical record or on a mobile device.
Wow. I mean, that seems pretty game changing for clinicians. I mean, they're busy, they're trying to focus on patient care, to have the different options. And I imagine that also might make it easier for organizations that are trying to roll out these functionalities by giving options, right? From
Right.
an organizational change management perspective, it's kind of hard to get adoption when you're telling users like there's one way and it's the only way, right? But
Correct.
by, like you said, meeting them where they're at, giving them options for how they can get the work done without it taking up so much time, I think is very important and strategic for leadership. Awesome. Well, Shelby, tee us up to challenge number 2.
Yeah, so challenge number 2 is that many traditional CMMSs don't offer a mobile solution for the tech on the go, which can be very inefficient and end up with poor data quality as they're having to go back to their desk or carry around a laptop. I mean, the amount of times I've seen techs with this, their cart with all of their broken medical devices, and they've got a laptop plopped on top of it. It's not the most efficient way when we can provide all of that. It's possible to provide all of that within an app on your phone. So really reducing that amount of time that they're going back and forth between their desk and the floors is crucial. Every minute counts when you're in a hospital, from the nurses to technicians. So we need to be able to reduce the delays in repairs, the miscommunication between technicians and end users by having that at your fingertips, and hopefully, reducing the impact on patient care.
Yeah, Shelby, would you say that, field service techs are often an underserved user when it comes to
Yes.
user experience?
Absolutely. I think, we're very forgotten in the hospital. I think you could probably ask anyone in your family if they know what biomedical engineering or clinical engineering is in the hospital, and they couldn't tell you. So they're often also forgotten by leadership, and taking care of your techs at the end of the day is crucial to making sure medical devices are repaired and PM'd in a timely and efficient manner. So providing leveraging technology is the next step for these departments.
And Louie, you guys, I mean, both you and Shelby were actually recently at an industry conference, a
Yeah,
biomed
AV
conference.
Exchange.
Yeah, talking on stage with people about some of these solutions and these challenges. What was some of the big feedback that you got from the people that were at that conference?
Yeah, so we have a lot of folks that are really interested in what ServiceNow is doing in this space, mainly around the mobile, kind of what we're talking today. Like Shelby was saying, there's a lot of CMMS systems out there that just don't either offer a mobile platform, or that just the mobile platform is very cumbersome and difficult to use for the technicians. And ServiceNow is really kind of changing the game in that space when it comes to mobile devices and how the technicians are going to be able to go from site to site using their mobile device. I know we keep kind of referencing more phones and devices, but we can also leverage iPads as well. Gives you a little bit more
Hmm.
real estate, but it also gives you just as mobile. Also, one of the features that we haven't really talked about today, that was also a big topic at Amy, was the offline capability of these mobile devices. There's always a fear of, if I'm going to a site, maybe I'm in the basement somewhere working on a piece of equipment, there's not always Wi-Fi or cellular where the technicians are working on a day-to-day basis. So the ServiceNow mobile app does have an offline capability where I can still document my time. I can still order parts. I can still look at my work orders. I can still close work orders. And as soon as I am connected to either Wi-Fi or cellular, it'll sync within ServiceNow almost immediately. There's very little lag time.
That is really cool. I mean, it's another example of meeting the technician where they're at in the basement,
Right.
right?
Yes. Yes.
Which is
Or
commonly where
wherever.
we are.
Yeah. So, well, that's really neat. Louie, can you show us what that looks like?
Yeah, absolutely. All right, so what I'm showing here is how the technician can open their work order and really close it in just a couple of clicks. So I have here on the screen, they open the work order, they hit close complete. The closure notes I documented through using the microphone piece. So I can document all of my work notes or my closure notes or whatever I did to complete this specific work order. using the microphone. So that way the technicians are not having to sit there and document on a tiny keyboard. And then from there, I can go ahead and hit close. And then it's off my screen, it's off my radar, and off it goes. These screens are also very configurable. And so, if one hospital or one organization wants to document some additional pieces of information upon closure, they can choose to go ahead and add those options, really at any point during the work order lifecycle, either when the technician accepts the work order or when they close the work order. But it's also very dynamic, and this is going to be really important. I don't always need to document maybe a closure code or an AEM review request, depending on the type of request, whether it's a project, a request, a corrective, a preventative maintenance work order. There's different items that we can make required or make suggested as the technician is closing their work orders. There are some assumptions here as I talk about that work order lifecycle. There are point in times where the technicians document their PM procedure. That can be done through mobile as well. Any sort of close codes, such as the PM was successful or maybe the PM had failed. And then with ServiceNow, if something has failed, say one of the procedures has failed, it automatically generates some corrective work orders to either take the device offline or do some additional repairs to that device. You can also order parts through the mobile device, do your time tracking, and as I talk about the AEM program, we have some clients that ask the technician specific questions for correctives, such as, could this have been preventative or prevented if we did a more frequent preventative maintenance schedule? And if so, they flag it, and later on it will show on some dashboards. So as we do our AEM reports or review, we can figure out whether we need to adjust any of our schedules going forward.
As a former clinical engineer who had to do the AEM risk assessments every year, and sift through hundreds of work orders on an Excel sheet, this is huge. I mean, it just really simplifies the process, and it's not requiring you to have to go pull data and analyze yourself when you're adding one extra step for the tech or another option for the tech, to then make, the AEM process easier down the road.
Yep. Yeah.
Well, and I love the loop back to the preventative aspect too, right? So it's not just fixing the surface issue, but going an extra step to ask the question, do we need to update our preventative maintenance schedules, or kind of doing that root cause analysis process and remediation process is really important for organizations to reduce that risk again. So I think that's that's great.
Yeah, I think another one of my other favorite features of the mobile agent app is being able to pull knowledge articles. So that there's knowledge module within ServiceNow, and I'm seeing a lot of biomed departments entering their manuals into as knowledge articles, and then the techs can access those knowledge articles within, at their fingertips, and see manuals and search for things.
Yep. Yeah, and as you talk about manual, Shelby, there's also some integrations that we can pull through as well. So we've been chatting with vendors such as OneSource, where they provide a lot of this documentation based on the asset and the model that you can do integrations to bring that content into your ServiceNow platform, so it is available there within your mobile device. So it's not necessarily only hospital created content. There can also be some third party content that you can download and integrate with as well.
That's huge. So Louie, there's actually a great question in the chat from Kevin about the need to sometimes go back to the clinician and make sure you have all the information. Can you kind of speak to how we address that?
Yeah, that's a really good question. So within the mobile device, I can not only document any work notes. When I say work notes, those are going to be more private that only other technicians could see, but I could also document some customer visible notes. So if there's some additional questions, maybe I can't find the device and I need to ask the clinician, hey, where did you last see this device? Type that into the chat. I can hit send. Since both the clinician and technician are both using mobile, we're assuming at this point they're both using mobile, it will send a push notification to the clinician, letting them know that either there's a new update, their work order has been completed, the technician is on their way, or there's new comments. And then the clinician can then respond back on the mobile device, almost as like a text message type format where I can communicate with the text message or communicate with the technician.
Yeah, I think that's a really good point. Also to bring up is that there is two applications here. If you go in the App Store right now on your phone and you search ServiceNow, you'll see the mobile app pop up, Now Mobile, and then the agent app. And the Now Mobile is where your clinicians can work and submit requests and issues. And then the agent app is for your technicians to do that, to work on the work orders. And they work together, and you can get push notifications from either and communicate between both
Mm.
apps.
And that answers that other question that from a person that's watching via LinkedIn about that bi-directional communication with the push notifications in the mobile app. So I love that we're serving both users, right? We're serving the experience on both ends of the spectrum, and that's how we get work done. Very good. Well, let's keep it moving. So challenge number 3, Shelby, tee us up.
Yeah, challenge number 3. I mean, this kind of deals with compliance. So there's in any hospital, there's certain regulatory and internal policies that you need to adhere to for governing bodies, and having that data standardized in a CMMS and be a single source of truth, and also be able to have good reporting against that data is crucial for biomed and clinical engineering departments right now. We really have to comply to very stringent regulatory requirements for medical devices, especially high-risk equipment, which commonly have to have 100% PM compliance every month. And making sure we have good documentation and are doing audits of our data, so that we can trust the data and have one clear and unified picture of our inventory and our maintenance history. It can be a challenge for a lot of hospitals that are, on traditional CMMSs today. So, also identifying and mitigating the risk associated with medical devices is another part of it, with recalls and cybersecurity. So, how can we use robust tracking and reporting tools to our advantage, is a big question I'm getting a lot these days from departments.
I was just in a customer call late last week, and we were talking about, you know, field services, and they were like, okay, what can you guys do when we get, when Joint Commission is doing an audit, right? Like I've talked to multiple, I think you guys have too, when there's like the big audit fear, like how can we make sure we're not providing too much information and
You
just
don't want to be
enough.
that department who screws up the Joint Commission survey. So you got to make sure all your ducks are in a row.
Exactly. So Louie, talk to us about what options are available for all the audit.
Yeah. So we have a couple of different options here that I'll show you. So the first one is going to be, one second here as I get this going. So the first one that I want to show you is with these auditors, they oftentimes will come to your hospital and they'll request some reports from you in advance before they go on site. And they will ask for things like audit history or work order history on a specific asset, or all assets within a specific building, or all work orders within a certain time frame. And so these reports need to be flexible enough to where your CMMS admin or your clinical engineering teams can create their own conditions. And so within ServiceNow, we have this thing called a condition builder where I can specify what do I want to show on my screen. I can sort it by model number, by asset tag, by building, by vendor, by manufacturer. However I want to slice and dice this information, I get the conditions exactly to what the auditors are looking for. And then from here, I can hit this print PDF. It's going to generate me a report. A branded report can have your logo. It's very configurable. So you, as your organization, can decide what information you want to have displayed here on the screen. And the information is pretty dynamic. It's your CMMS admin or your clinical engineering leadership team that can, in the moment, decide what fields that we want to add to this report. And then as I print to a PDF, it's going to give me one asset per page. So it gives me my asset information, when's the last time the PM was completed, the next PM date, what's my PM schedule, and it will even show the last PM procedure as well. So this is one of those views that we can generate these reports, generate this PDF, and then hand it over to the auditors. But there's some additional dashboards that your clinical engineers will need access to as well on a day-to-day basis. This is great for exporting that data, but how do your technicians ensure that all of our devices are being kept up to date on a regular basis? So we have a couple of different dashboards here. This is our CMMS dashboard. This is something that your leadership team or your clinical engineering leadership team would see as soon as that they log in. You can see my PM success rate for high risk versus non-high risk assets, all of my medical devices, how many are in service, how many work orders that I have that are overdue, what was my PM compliance last month, or what is it so far this month? And it really helps them keep track of where they're at on a day-to-day basis so they can address some of these issues early on.
Mm. And that's all dynamic, right, Louie? Like they can click in and drill down and make it
Yeah,
actionable.
absolutely, absolutely. So any of these widgets, I could click in and get a little bit more information. I could split it and slice it by department, by building, by cost center, however you want to look at that information or how you have your assets separated. I can drill in and look a little bit more. I can also change any of these filters. So when I talk about being able to go dynamic, I can choose a specific location. I can split my dashboard up versus for like correctives versus preventatives versus safety alerts if I only want to look at a specific type, or I can also look at a specific date range as well. Maybe I only want to look at the items that were submitted last month or that were serviced last month or last quarter, or let's go year to date. So it gives some flexibility to whoever is logged in on how they want to view that data.
I mean, Shelby,
One,
what would this be like for, clinical engineering that isn't used
Yeah.
to these types of tools? How would it change their day to day?
Yeah, I mean, first the printout is really crucial. I think we're seeing a lot of more standards coming out where these like blood bank or other lab departments request biomeds PMs every month. So being able to choose what you want to provide to them, because you don't need to really provide everything, and it's just a lot cleaner for everyone to see what they need to see is important. And being able to print that out easily and send it over is easy, easy for everyone. And then having these dashboards that you can also, have something that's very, you start with something like this that Louie's showing, and then you can edit it as you see fit to be personal to your organization. Because I've learned the hard way that every biomed department has different processes, different maturities. They're wanting to see data in different ways. So ServiceNow really gives you that flexibility to see the data how you want to see it.
I think that's
there's
an
one
important.
one more dashboard I'll go
Go
ahead
ahead.
and call out as well. So this one's very similar, a little bit more for that leadership team, but this will kind of catch some of that information, some important actions that your technicians may need to take to keep their data up to date. It'll give them things like assets that are missing a PO number, or assets that are missing a serial number, or contracts that are about to be expired. These can be service contracts or warranty contracts, parts contracts, anything that you have within your ServiceNow instance. We can create some alerts so that way you can take action again very, very early.
So, Louie, an organization that wants to leverage the mobile app or wants to leverage clinical device management on ServiceNow, they would need to have asset management implemented as well. Is that
Yeah,
correct?
yeah, that's a good question. So when you purchase that clinical device management license from within ServiceNow, you're really getting two major modules within the platform. You're getting enterprise asset management, which is what you're going to use to manage all of your assets, your PM schedules, your PM procedures, everything that essentially your auditors are going to be looking for from an asset component. But you also get field service management as well, and that's going to be your work orders and work order life cycles.
Okay, I feel like I can already hear people thinking in our audience, like, oh, doing data migration for all of our assets, our data's awful. That's a very daunting process. And I think this is a good transition into kind of the practical steps. Like, I bet some of our listeners are like, oh, we really need that. We need that functionality. We need that user experience. But how do we get started? What do we do first? So I'd like to ask both of you guys, like, what's your take on practical steps that a hospital or health system can do if they are interested in going on this journey?
Yeah, I can start us off. Definitely, if you're thinking about moving CMMSs, if it's in the near future, get started now. If you've got a bit of time, take some time to document your processes within policies, and develop a CMMS governance. And maybe your IT department might have something similar, and so maybe piggyback off of them and see if you can do something similar for your specific management system. I also recommend, the big part is data migration. We have to migrate so much data for compliance. And so making sure that data is clean so that we don't have bad data going into a good system is crucial. So I recommend like data standardization before migrating to a new CMMS. I recommend like ECRI has a really great data standardization program, and they do integrate with ServiceNow so that after you do your initial standardization, you can continue with an integration on ServiceNow's platform for your model, manufacturer, that kind of data.
I'm going to pop the link to ECRI's data standardization program in the chat here in case anybody's interested in looking into that. Thanks for that recommendation, Shelby.
Yeah, and I think another big one that often gets forgotten about in projects I've seen is if you're moving into ServiceNow, probably your IT department is already in there, and so core tables like your locations, your departments, your cost centers are probably hopefully standardized to the organization. It might not necessarily match what you have in your CMMS if it's on a separate platform, unless you have some integration or you've already standardized that data. Good on you. You're doing a great job. If not, take that time to also standardize with the rest of IT, because you'll be sharing some of those very foundational tables with location data and department and stuff.
Yeah, and just to add to that, that foundation is really going to be able to build the platform so you can use some more advanced features within the platform, within ServiceNow, being able to transfer tickets between IT, clinical engineering, facilities seamlessly between the two is one of the really big advantages that we see out of a platform like ServiceNow. But also, I feel like we have to talk a little bit about AI. Every conference that you attend nowadays, every software that you look at, they're all looking at how can we leverage AI. But it really is going to start with some of these core foundational tables that Shelby is talking about. Without that strong foundation, it's going to be very difficult to leverage some of those advanced features. So one of those next steps might be doing an assessment of, what do those core tables look like? What does your documentation look like? What does your data look like? And then really get some recommendations and start working on cleaning up some of those items before we do a data migration into a product like ServiceNow.
That's great advice. Thanks, you guys. I'd like to open it up for some Q&A, and I'm going to scroll through the comments here too to see if any have come in. Scott, what are you seeing? Any good questions we can answer that we haven't yet?
Yeah. Well, you had already addressed that one question from Kevin, which I think is great. One question around security and privacy of patient and device data. There's just some concern around using a mobile app around that. Is there any way that that we can address that?
Yeah, so when we start talking about some of the patient data that could be coming over into the mobile app, there's a couple different options. We either move that patient data into a more secure, added extra encryption into these fields, and then we can select those fields not to be stored locally on the mobile device. But as we start talking about some offline modes, there's some data that eventually gets stored on the device itself, but we can be very selective about what data is actually stored. Anything patient information will need to have, only stored on the ServiceNow database.
Excellent. Thank you, Louie. Another question around how does this app integrate with existing ITSM tools and workflows?
Yeah, that's a really good app. So like Shelby had mentioned earlier, there's really two different apps. The clinician one, which is now mobile. And so w- speaking from the clinician standpoint, clinicians are going to be able to submit an IT ticket or submit an HR case or submit a clinical engineering all within one app. They really shouldn't have to go through different types of apps or different screens. Let's just get everything collectively in one space. And then for the agent app, those are going to be more of your fulfillers. The same thing though, IT can work in the agent app side by side to facilities and clinical engineering, and it's all based on the security and the access that you have within ServiceNow. It's going to control which screens that you can see within the mobile app, and then which tickets, of course, that are going to be assigned to you.
That's great. Thank you, Louie. We just got a question in from Omar, and he'd like to know, how do we go about finding opportunities for ServiceNow CSA?
You mean the certification?
Yes.
Oh, okay. So Omar, I would just recommend logging into Now Learning and taking a look at all the certification programs. There's a lot there, and I will mention, just to kind of weave that into our topic today, that for organizations that decide to implement clinical device management on ServiceNow, or really anything on ServiceNow, getting your technicians and getting your platform admins the appropriate training is going to be very important. So that's another way that you can prepare for a successful transition to this CMMS. And also, working with a partner who has experience like this. Obviously, Optimum has, experience in this. We can come alongside your platform team and help help train them and make sure that everybody is enabled to use the systems effectively. So
Yeah. And there a very similar question from Nisha. And yes, this is if anyone's interested in working in the universe of healthcare and ServiceNow, Optimum is the ServiceNow partner of choice for healthcare. So get your certifications and join them, because they're doing amazing work. I think we have time for one last question, and that is around ROI. What kind of ROI or success have other healthcare organizations seen from using this app?
Yeah, so I could try to answer that one. So the clinical device management modules is fairly new, but organizations have already seen some huge benefits from it. The financial benefit would be oftentimes ServiceNow licensing is going to be cheaper than some of your other larger CMMS products year over year. And then you have the added benefits of some of the productivity and visibility into your dashboards, which is going to contribute even more to that ROI. So being able to transfer back and forth between your different IT teams or your different departments within the hospital, really big benefit. A unified view for your clinicians, again, provides a lot of ROI. We get access to some of these work orders early. The clinicians aren't afraid to submit some of these work orders. So we almost see a financial benefit on reduction of costs of having to purchase some additional items or additional medical equipment as well.
Shelby, I'm curious about your thoughts too, just in terms of time savings, right? Like fewer clicks, fewer manual processes or manual steps, less time trying to get data. What's your take on potential sources of ROI?
Yeah, I think we've talked a lot about time, and that's it's going to be beneficial for time on the tech and clinician side by having things like mobile app or an intuitive platform that makes it easy to get paperwork done and to find the information you need within your management system. So from my experience, half of the ROI is just your tech's experience and how they feel on the platform. So if you get their buy-in, then I think that can say a lot more than the financial ROI.
Mm. We got to make our employees happy, right? Happy employees, happy
Exactly.
patients.
Absolutely. And I'm sure there's a lot of happy technicians after watching this. And we appreciate everybody joining us for this. Louie, Shelby, Natalie, this has been really great. Really appreciate you taking time. And everyone who joined and asked questions, thank you so very much.
Thank
Thank you,
you.
everybody. Have a great day.
Thanks, guys.
See you.
Bye-bye.